Hello, my name is Dr. Dewan S. Raja. Today I will discuss about pharmacology of digoxin. Digoxin, a cardiac glycoside, is an inotropic drug, so it will increase the force of contraction of the cardiac muscles. So it will increase the stroke volume, therefore it will increase the cardiac output. So this is a drug used in case of heart failure. It has positive inotropic action, but it has negative chronotropic and negative dromotropic effect on the heart. So the heart rate will not be increased, and the conduction through the conducting system of the heart, like SA node, AV node, bundle of His, to the Purkinje fiber, it has negative action there. So it is also used to manage the cardiac arrhythmia. So it is a drug used to treat heart failure, plus it also helps in the management of some arrhythmic condition. Mechanism of action: draws excess sodium and calcium inside the cardiac muscle, acts on sodium potassium ATPase and sodium calcium exchanger on the cell membrane and cell, stimulates the vagus nerve and decrease the impulse through the conducting system of the heart from SA node to the Purkinje fiber. Okay, so if we go their mode of action, here is the sodium potassium ATPase system on the cell membrane. Here digital is block this part. Okay, so what will happen? There will be more sodium inside the cell, and that excess sodium will decrease the driving force on the sodium calcium exchanger. So there will be more accumulation of intracellular calcium that will cause contractility in the cardiac muscle. So this is the mechanism of action of the digitalis, also called the foxglove glycoside. Digitalis means foxglove. This is an ornamental plant, occurs in the nature, and for many thousands of years people used to take it to manage their cardiac problem, but doses was not adequate, maybe overdose, underdose, but it was scientifically presented in 1785 by William Withering, an English physician and botanist. So these digoxin-like substances are present in the plant, in the flowers, like foxglove and some other plants. It is also found in the skin of the toad. Okay, so the toad skin also contain digoxin-like substances. So therapeutic uses of the pharmacology of digoxin: severe left ventricular dysfunction after initiation of diuretic, angiotensin converting enzyme inhibitor, and beta blocker therapy. Okay, so after initiation of this medication, then we use the digoxin. Digoxin is essential in the management of left ventricular heart failure or left-sided heart failure, to control ventricular response rate in atrial fibrillation and flutter. But we must remember, digoxin is not indicated in patients with diastolic or right-sided heart failure. It is not indicated there. So what are the adverse effects of digoxin? It has multiple adverse effects on gastrointestinal tract: anorexia, nausea, vomiting, even diarrhea is possible. On cardiac toxicity: paroxysmal supraventricular tachycardia, ectopic ventricular beats, ventricular tachycardia, ventricular fibrillation, and may lead to hyperkalemia. Central nervous system adverse effects include headache, fatigue, blurred vision, alteration of color perception, and halos on dark object. Okay, so if we go to the mechanism of action, we have something to add. It shortens the refractory period in atrial and ventricular myocardial cell. It prolongs the effective refractory period and diminishing conduction velocity in Purkinje fiber. So these are also its mechanism of action. Digoxin can be administered orally or intravenously. It takes several days to adjust the doses, especially in oral application. It may take 7 days. We go with small doses, it will go up. It has narrow therapeutic index or window. So doses should be optimum, should not be underdose, should not be overdose. If it is underdose, there will be no action. If it is overdose, then there will be toxicity. So the window of therapeutic window or therapeutic index is narrow. So we need monitoring the blood and the patient's conditions. Drug interaction. Many drugs like quinidine, verapamil, amiodarone, potassium depleting diuretics, corticosteroid interact with the digoxin, may lead to digitalis or digoxin toxicity. So what are the factors that predisposes to digitalis toxicity? Hypokalemia, potassium or patient taking thiazide or loop diuretics, hypercalcemia, hypothyroidism, hypoxia, myocarditis, hypomagnesemia, renal failure, liver diseases, all lead to digitalis toxicity. So hypokalemia. It may be the adverse effect of some of the diuretics or patient taking the thiazide or loop diuretics, okay, that lead to hypokalemia, hypercalcemia, hypothyroidism, hypoxia, myocarditis, okay, myocarditis, hypomagnesemia, renal failure, okay, so myocarditis and renal failure, okay, so we got that. Okay, so and liver diseases, toxicity can be managed by discontinuing digoxin therapy, determining serum potassium level, and if indicated, giving potassium supplement when there will be hypokalemia. Serum levels of potassium digoxin must be closely monitored, and we also must look for the renal function test like blood urea nitrogen, serum creatine level. We must also assess the liver condition, liver function test, because the digoxin is metabolized in the liver. It is excreted in the urine through the kidney. So kidney and liver should be okay. We must go through the liver function test and renal function test. Okay. Severe toxicity resulting in ventricular tachycardia may require administration of antiarrhythmic drug like lidocaine or phenytoin, and the use of antibodies of digoxin, that is digiban. Okay, so we must closely look for the potassium and digoxin level. Both, that is also essential, in addition to assess the liver function and the kidney function. Okay, so that's all about the pharmacology of the digoxin. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.